Hey there. Okay, I want to talk through some newborn baby stuff with y'all. I have this whole document that I made. I tried to just make a list of all the things that parents have asked over the years to like prepare for baby, and it was kind of long, and so I'm kind of trying. I'll zoom in. I'm going to work through this. First and foremost, my name is Phil. Can you see this? Boucher. I am a pediatrician. I've been in Lincoln for about 12 years now. I grew up here as well, but I've been a pediatrician here for 12 years. My office is called Frontier Pediatric Care, and our office is located at like 84th and Old Cheney, right around there, like by Rock and Joe and Vic's Pizza and that sort of area. A couple different things in the particular that I want to talk about tonight. First and foremost, I do know that sometimes I like to ramble when I'm talking about babies, but I have a clock up here, so I'm going to keep it under 30 minutes so you can all move on with your day and your evening. There's a couple different areas, though, that I want to talk through. One is before baby arrives, and then at baby's arrival, and then what those first and second few weeks look like, and kind of what to expect as you go through things. I'll tell you a little about my clinic, Frontier Pediatric Care, too, as we go, and just kind of how we do things. I want to start actually when baby arrives. And so I'm going to start with the kind of at baby's arrival sort of things and kind of work our way from there. When baby first arrives, obviously, you'll learn and talk about all of the delivery stuff. I'm just going to take it from like baby is here. So typically the first thing that they do, we talk about like the golden hour for babies. When they first arrive, they have this period of time where essentially as long as everything looks good with baby, they're screaming, they're pinkish in color, they're wide awake and those sorts of things. They just give baby right back to mom. So they don't take them over, they don't weigh them typically to start. They don't do a lot of things. They set them right back up on baby. And there's a reason for that. One is like you went through all this work, you deserve to hold your baby. But two is there's this golden hour concept where essentially in the first hour, skin to skin, and if possible, latching and nursing help with a bunch of the different things that have to happen when it comes to your baby transitioning from the womb to the world. So things like blood sugar, pulse, temperature, blood pressure, all of those sorts of things are improved when we have that golden hour time together, when we have that skin to skin and ability to latch if possible with nursing. All of that, these are all different things that baby has to kind of work to transition once they're out of the womb, and all of those are helped by that golden hour. And so that's typically why, first and foremost, they'll just give baby right back to you. You can snuggle, you can hold them, you can stare at them affectionately. And that first hour there's a reason for that, both from a connection and all that work that you did, but also from a physiologic standpoint, it helps them to move through their transition from the womb to the world. Now, in the hospital, I'm kind of just going to go through this checklist of different things that they do for baby once baby arrives. One is they do this newborn screen. Now, this isn't done until baby is at least 24 hours old. And sometimes we'll have parents that either deliver at home accidentally or on purpose, or leave the hospital early or something like that. We do sometimes do these in our office for parents on the outpatient setting, but typically it's done before you go home from the hospital. And what they do is they poke baby's heel and just take a couple of drops of blood, and then that looks for inborn errors of metabolism. That looks for anything where we need to adjust the diet. Like if they had, on the Diet Dr. Pepper cans where it talks about attention people with PKU, phenylketonuria. This product contains phenylalanine. Well, that's a inborn error of metabolism where if your child or you as an adult have PKU and you take in phenylalanine, it causes the amino acid to build up in your blood and causes developmental delays and is toxic to your brain and all those sorts of things. So that's one of the things that we test for is a bunch of different inborn errors of metabolism where we say, okay, your diet needs to be free of phenylalanine. Now, these are rare conditions, but they are life-limiting, life-threatening, and they're things that we can do about. Another one that recently came up in clinic was hypothyroidism. Babies that are hypothyroid, like they don't have any thyroid hormone, are at risk for growth issues and developmental delay and lower IQ and a bunch of different things that we can avoid by doing the newborn screen where we check and we say, oh, their thyroid level's low. This happened in clinic about a year ago. They called me on a Saturday. They said, hey, we got a baby that was born. They sounds like they're doing fine at home, but we just got their labs back and they have congenital hypothyroidism. So we get them on thyroid replacement. Those are sorts of things that we can do with the newborn screen. It also looks for things like immune deficiencies, cystic fibrosis, things along those lines. So that's newborn screen. Now the next one, the nurses refer to this as the eyes and the thighs. And this usually happens within the first 3 to 4 hours after delivery. And it's a couple different things. One is the thighs, which means they give them an injection of vitamin K and then hepatitis B and then some eye ointment. So this is the thighs because they're injections, and this is the eyes. Now, if you're telling me, I'm not really sure. I'm not sure if I want to do all of those. If I had to pick one thing to say, please consider strongly doing, is the vitamin K. Vitamin K is a vitamin that you and I have in our blood that helps with blood clotting, which prevents bleeding. Babies do not have vitamin K. Our vitamin K comes from the bacteria in our gut. In babies, they don't have vitamin K because they don't have bacteria in their gut. Their gut is sterile, and it takes weeks for them to start having bacteria in their gut. That's why, here's a spoiler alert for you, their poop doesn't smell when it first comes out because it's sterile. It doesn't have bacteria that make poop smell. But their vitamin K helps with clotting, and it takes a few weeks for that to get up to speed. And in the meantime, they can be at risk for serious bleeding episodes. And we're talking about bleeding episodes. We're not talking about a bloody nose or, they're playing on the playground. Obviously, they're a baby, but they scrape their knee and it just keeps bleeding. The two serious bleeds that we're talking about and looking for in particular are brain bleeds and bleeds into the gut, which can be life-threatening and life-limiting. Vitamin K gives a boost to our clotting system to make those blood clots so that we don't have spontaneous bleeding episodes. We want to avoid spontaneous bleeding episodes. And going through the labor and delivery process is pretty traumatic and puts us at risk for spontaneous bleeding because of that. And then hepatitis B is a immunization against hepatitis B virus. Now, it is not common for babies to get hepatitis B virus unless they're exposed to it from mom having hepatitis B, but it is something that we want to consider doing because hepatitis B can be spread from person to person easily, and most adults can be carriers of it without knowing that they have it. But in infants, it can cause liver inflammation, and worldwide is the number one cause of liver failure and liver transplantation. And so that's why it's suggested that that's done at birth. And then the eye ointment is to protect against bacterial infections that can be acquired during birth that can cause issues with bacterial eye infection. And so if you're asking me, prioritize these, doc, I don't want to do all three, I'm only willing to do one, I would do the vitamin K. But they're all recommended and reasonable to do as well. But the vitamin K is the one that is the most acutely life-threatening, life-limiting that I would highly suggest you consider. And if you're not sure, talk with somebody about it. Get the information. I know that it's really confusing out there with social media and TikTok and Instagram and all of the different voices that it can be really confusing. So I would encourage you to find some good resources and people that you can trust and talk them through. One thing I'll talk about later, but in our practice, we do a lot of text messaging. And so parents that are having a lot of questions often just text message us. And so you can just text message us. If you have a question or concern that you want to kind of talk through, this is our phone number. And even though you're not members of our clinic yet, if you had specific questions that you just wanted to kind of talk through, like, hey, I'm not sure what to do about this, or I'm not really sure what I should think here. This was confusing. I saw this on TikTok. This is our phone number that y'all love texting. So just text us instead of calling. You can call too if you want. Okay, I'm not talking fast enough. I see the time here. I'm going to talk even faster. I'm going to just pick a couple of these. So before you go home from the hospital, they'll do the hearing screen. They'll do a congenital heart disease screen. Those are just quick, easy things that the nurses do. One of the things that you'll find and hear a lot about during your hospitalization is bilirubin, their jaundice level. Bilirubin is a molecule that builds up in the blood of newborn babies for a bunch of different reasons that we don't have to get into, but it makes babies more yellow. And so you'll hear a lot about your baby's color because we're watching to make sure that they don't get too jaundiced in the first days of life. The reason for that is because if the level will rise and your baby will be a little bit yellow over the first days of life, but we don't want it to get too high too quickly, because then what we have to do is we have to get that level back down to a safer place. And so if you've seen the babies on TikTok or Instagram that are under the blue lights, they look like they're in a tanning bed. Those are babies that have high jaundice levels, high bilirubin levels, and we're using UV light to blast those levels back down. Usually the jaundice level doesn't get too high too fast, and it usually doesn't happen until you go home from the hospital. And so typically what will happen is we'll go home from the hospital, and then we'll see baby the next day, and we'll check their jaundice level, or at least check their color and see how they look, and decide if we need to do anything more from there, because usually bilirubin levels reach their peak days 3 to 5. So that's usually when you're already home from the hospital. But we want to make sure that it's not getting too high too fast that we need to do anything for. And so that's something that we'll watch closely. Typically, days in the hospital is determined by the route of delivery. So vaginal delivery is usually like 2 nights in the hospital, and C-section is usually 3 to 4 nights in the hospital. Our practice is pretty lenient about letting people go home from the hospital. Some people like to stay in the hospital, some like to go home on the quick side, and so we'll meet you where you're at when it comes to hospitalization and how long you want to stay in the hospital. And it's usually more a function of when mom is ready to go home from the whole labor and delivery process, rather than when baby specifically is ready to go home. And then one specific thing that's relevant during RSV season, which is October through March typically, is RSV antibodies. So there's a medicine that's come out in the past few years called Beyfortus. It's not a vaccine, but it protects against RSV. And the way it does that is it actually, you think about a vaccine. Vaccines stimulate the immune system to fight an infection by making antibodies. This shortcuts that process and actually gives babies the antibodies themselves that protect against RSV. And when we talk about protection from RSV, we're talking about like a decrease in 80% of hospitalizations for infants with RSV. So it's pretty substantial. When we look at causes of why your infant might get hospitalized in the first year of life, the number one thing is RSV. It's a virus. It causes a stuffy nose, cold, and cough in adults, but in infants, it can cause more respiratory distress and the need for oxygen. And so when we see babies that are in the hospital in the first year of life, it's by and large a lot of RSV. And so this has been a really cool development for families to protect. Hospital can give it out. We give it out in our clinic too, depending on the time of year and what parents prefer. But it's something that goes to work in like 6 hours to start protecting against RSV. So it is pretty cool that we're able to protect against RSV. We avoid another vaccination if that's your hope, but it does protect against RSV and against hospitalization. So those are kind of some of the big hospital things. One of the other big things in the hospital is feeding. And really in the first days of life, feeding is going to be your main source of stress and the main thing that you do. We talked a little bit about the golden hour with if you can get baby latched, if you can do some nursing in the first few hours of life, great. It helps baby to get colostrum. It helps tell your body, hey, start making milk. Your milk will start to come in more over the first couple days. I always tell parents the thing about the first night, because a lot of times I'll go into the hospital to see a baby and it'll be their, they were born yesterday, and the parents say, hey, doc, we got a good one here. He slept great last night. And I'm always like, awesome. He's going to be up a lot tonight. And so I try and like reset people's expectations, because like, yeah, we had to wake him up. He was hardly up at all. Baby went through a marathon with delivery. And so of course, after a marathon, everybody is exhausted. That will not last. And so I just like to let people know, like the first night, get as much sleep as you can. They'll have you wake up every 2 to 3 hours to feed baby, sleep in between. Baby will be groggy. That second night is when baby will start the cluster feeding. And cluster feeding is, like it's named, a cluster. That's not why they call it that, but it is a cluster. Baby will wake up every 10 to 15 minutes, want to feed, fall asleep. You'll put them down. You'll think, okay, I'm going to get some rest. They'll be back up 10, 15, 30 minutes later, wanting to feed again. This is a normal standard feature of babies on their second night, and it helps to bring your milk in. Baby is saying, hey, I am awake now. I recovered from my marathon of delivery and I am hungry and your body is not making enough milk just yet. So I'm going to help stimulate it. The more times that you put baby to breast and empty as best you can, that drives milk production. And so then you'll start to make more milk. But just as a heads up and like a be prepared sort of thing. Now, when it comes to the typical weight loss that we see with babies, I think a lot of parents, especially first-time parents, don't realize that it's normal for babies to lose weight. And so that's something that I really talk and let parents know in advance about so that they're aware. Because what I don't want to happen is the nurse is giving report in the morning to her nurse colleague that's taking over, and you overhear them saying, baby was down 4% or baby was down 8% in their weight, and you're sitting there like, what the heck? I thought these babies were supposed to be getting chubby cheeks and thigh rolls and those sorts of things, and you're telling me my baby is losing weight. It is 100% normal and expected that baby will lose weight for the first few days of life. What that looks like is typically we lose 3 to 4% in the first day, and then by the next day we're down another 3 to 4%. So we're at the 7 to 9% on day 2. This is day 1, this is day 2, and then day 3 we're usually down around 10% weight loss, which is pretty standard. Is about 10% weight loss is what your baby is going to lose. So they're born at their birth weight, they lose about 10%, and then they start to gain weight. So this is birth, and they will not be back to their birth weight until they're about 2 weeks old, so about 14 days. And so during that time, they're going to be below their birth weight, and most babies will then lose about 10% of their birth weight before they start to gain weight. And what that looks like is usually babies are at their lowest weight on about day 4, and then start to recover from there to get back up to where they should be by about 2 weeks, about back to their birth weight. So those are the milestones to watch for. So don't be surprised if the nurse comes in and says, hey, your baby's down 4%, or you're going home from the hospital and your baby, it's day 2 and your baby is down 9% or something like that. That is very typical weight loss. Now, a couple of other things that we'll do and we'll talk through, especially if we're getting down around 10% of weight loss, is we'll talk through triple feeding. And essentially triple feeding is a way to get your baby extra calories to help make the bridge from, hey, I just arrived, you don't have a lot of milk in, I'm getting really sleepy, to you have a ton of milk in, I'm getting what I need. And so triple feeding looks like 3 things. Number 1 is feed every 2 to 3 hours. Pardon my terrible handwriting. Feed every 2 to 3 hours. Pump 10 to 15 minutes per side. And then supplement. And I'll talk about supplementing in just a second, but then you're going to supplement so that baby gets a little bit extra, because with feeding, baby doesn't eliminate everything, which is why we pump. And then we supplement after that, and that helps to increase total calories that baby gets and helps them to have more energy and improve their suck, which then helps them to increase your milk production. Oops, I lost it there. Increased milk production. And so the supplementing can look like the pumped milk that you have. It can look like donor milk. In the hospital, they can give you donor milk. I don't really recommend outside of the hospital setting getting donor milk, because in our area, at least, it's quite expensive to get donor milk, and there aren't good studies that show that it makes a difference in term babies that are just going from the hospital, and we're working through getting them adequate calories or those sorts of things. Doesn't make enough of a difference to justify the cost in my mind. Now, locally, we do have some milk banks that are free, and your doctor or the nurse can probably talk to you about that. So getting it from there, but other places in town that sell milk, I would not spend that money. Or 3 would be formula. Now, on the donor milk topic too, sometimes people will have a friend that has extra milk, and that's something that you could discuss with your doctor as well, is, hey, my friend has a bunch of milk, I trust her, can we use that? Typically we say yeah, because the risk of infection or transmitting something is quite low in general, and if it's somebody that you know and you trust and you feel comfortable with that. I think most people will just do it without asking anyways. But the third would be formula. Formula is perfectly safe and helps to get more energy to baby, which then can improve breastfeeding in the short and the long term. There's studies that show that babies down 10%, we give them some triple feeding, which looks like nursing, pumping, and then supplementing with either pumped milk or making up for it with formula. And that helps to get baby enough energy to suck more efficiently, to help with that kind of cycle of getting in the good system of having enough energy to suck and bringing more milk in and getting more milk and having more energy. And so there are studies that show that supplementing with donor milk, with pumped milk, and with formula can all help to extend breastfeeding success. Now, having said all that, breastfeeding is hard. And so getting help and support is really important when it comes to nursing. Nurses in the hospital are super good at it. There's lactation people in the hospital that are super good at helping. I encourage people to bug them on a regular basis. What should I do now? Okay, this is working well, but what if this hold isn't working? Or what are some other holds that I could try? There's so much that you can work through. In the community, there's great resources too. We actually have 2 lactation counselors at our practice that do home visits. And so there's lots of good resources in the community to get the support that you need for breastfeeding success and like setting up what that success looks like. But I always tell people, like, yeah, your friend that is mowing the lawn while nursing their baby says that it's super easy, and maybe it is for them, but for by and large, for most people, especially the first time, it's pretty tricky to figure out, and it's not as natural as it necessarily seems like it should be when we're getting started and recovering from delivery. Okay, now talking through things more before I run out of time with y'all, there's a lot of weird stuff that parents often ask about that are normal. Hiccups and sneezes are really normal. It doesn't mean that your baby's allergic to your cat or your dog or anything like that. It's just that baby's brain is not well developed enough yet to suppress all of the hiccups and sneezes. So it's just a brain maturation thing. It is normal for babies to spit up quite a bit too. What you'll see in the very first days of life is that they often swallow amniotic fluid, which will make them spit up more frequently. And so that will play a role. And then as they get bigger, sometimes it's a volume thing. Sometimes it's they didn't burp, or they're starting to push more, scream more, and that increases abdominal pressure and just brings things back up. Very normal. A lot of babies will have this rash. I should pull up a picture of it, but it's called newborn rash. It's these little red dots that are just kind of all over baby. It actually looks a lot like this because they kind of have some white clearing and then a red dot. Entirely normal. It has a terrible, scary name called erythema toxicum. Some jokester got to name it and made it sound like the scariest thing ever, but it is just referred to as newborn rash typically because it's normal and it's not scary and it goes away on its own. Periodic breathing is one thing that parents are often worried about. They will text us and say, my baby's doing this breathing, is this normal? And we reassure them that it's periodic breathing. Essentially what happens is baby will breathe really fast, and then to re-equilibrate their carbon dioxide level, breathe really slow. And then they'll breathe really fast and blow off all their carbon dioxide, and then they'll breathe really slow to let it reaccumulate. And that, again, is a brain maturation sort of thing where our brains are just not mature enough yet to regulate our carbon dioxide level. So they'll have periods where they're breathing fast, and then they'll have periods where they're breathing slow. Brick dust is one that comes up sometimes. This is specifically where you'll change their diaper and there's a little bit of faint redness in it. And it's just in the first couple days of life that you'll sometimes see this, but it's freaky because you're wondering if your baby is like peeing blood or something like that. It's just brick dust, which is just crystals in the urine that turn red in the diaper. And so you might see that. In little baby girls, too, they often will have some clear or white vaginal discharge in the first days and weeks of life, normal. And sometimes around 2 weeks to 4 weeks of life, they will actually have a little bit of blood, like a period, because the hormones, the maternal hormones, are washing out of them. So they'll actually get a little bit of blood, too. Obviously, it's something that you're going to probably bring up to your doctor, but also normal, too. And then the umbilical cord. There's all these like old tales and folk remedies for the umbilical cord. Just leave it alone. You don't need to put alcohol on it. You don't need to do anything special with it. It will dry up on its own. It takes about 2 weeks for it to fall off. It will be a little bit of bleedy or sometimes there'll be a little bit of gunk actually that comes out of it as it heals up, but just leave it alone. It will come off on its own within about 2 weeks. And then lastly, when it comes to baby's arrival, the peeing and the pooping. In addition to feeding, you're going to spend a lot more time than you ever realize thinking about how much your baby is peeing and pooping. In the hospital, what I tell parents is number of days old for number of wet diapers. Number days old. So a baby that is 1 day old should have 1 wet diaper. A baby that's 2 days old should have 2 wet diapers. A baby that's 3 days old should have 3 wet diapers. And that quickly ramps up to the point where you're like, gosh, I miss those days where we only had to change 4 wet diapers because now they're peeing all the time. But until your milk comes in, until they start to gain weight, they're going to have fewer wet diapers, just like you or I. If we weren't drinking enough, we would be on the dehydrated side. For pooping, we expect to poop typically in the first 24 hours. And then it will be really black and tarry, but not smell. And then over the coming days, as your milk comes in, it'll work its way towards yellow. And before that, it will be kind of brown green. And then it will be seedy, where it looks like there's a bunch of little tiny like mustard seeds, and it's like mustard colored. And that will happen over the first week where your milk starts to come in. And then later down the road, I often hear around, especially in breastfed babies, around 2 to 3 months, they go from pooping every single time that you feed them or a bunch of times a day to just once or twice per day. Basically, when it comes to the number of poops in a breastfed baby, outside of that like first days of life, we can have anywhere from, like 12 times per day, like every time I feed my baby, they poop, to every few days. So anywhere in there is a normal range for babies for pooping, especially for breastfed babies. Okay, now despite my talking relatively quickly, I do see I'm running out of time, so I won't be able to share everything. But you can sure text us if you have more questions as you go. But one thing that I wanted to talk through is, as a pediatrician, one of the things that we help with a lot is my baby sick? And so I wanted to share with you really quickly my approach when a parent calls us or texts us and says, I'm not sure what's going on with my baby. The reassuring signs that I have that your baby is not acutely in distress, the first and biggest one is feeding. Sick babies do not feed well. So if you say, hey, my baby's a little bit off, the first question that I'm going to ask is, how are they eating? Oh, they're eating normal. If we're missing multiple feeds, if we're sleeping through feeds, if we're can't wake them up for multiple feeds and other things are going on, then that's going to be much more concerning than a baby that is feeding well and feeding on time. Now the second one, so feeding is number one, and then breathing. How's your baby breathing? Well, if they're breathing easily, that is the best sign of all. We talked about the periodic breathing where they breathe fast and then they breathe slow, and that's normal too. But I want to hear that they're breathing easily. They're not working hard persistently to breathe, or they're not so softly breathing that you really can't tell that they're breathing at all. So feeding and breathing, and then fight is the third one. If you pick your baby up and they're awake and they give you a little bit of fight versus being a limp noodle, that's a good sign too. If they've got some muscle tone to them, if they get angry and upset when they're taken out of their warm, comfy environment, those are good signs. The concerning signs is a fever. Now, in the first month of life, we're going to do rectal temperatures, and a temperature greater than 100.4 taken rectally is going to be a trip to the emergency department if they're under a month old. And the reason for that specifically is because we worry about serious bacterial infections that they're more prone to because their blood-brain barrier is not developed, their immune system is not well developed yet. And so a fever in the first month of life, we're always going to take it rectally, and if it's 100.4 or greater, that's going to be a trip to the ER. Other concerning signs outside of the fever would be persistently poor feeding, persistent fast breathing, slow feeding or slow breathing, or floppy or difficult to wake. And this is the one that I always tell parents, you have good instincts. If you think something is wrong with your baby, then there's something wrong in my mind until it's proven otherwise. And so if you have the instinct, okay, there's just something that's not right. I can't put my finger on it, but this is more than just, they're just sleepy or they just had a big feed, something along those lines, then getting reassurance and support is something that you should definitely look for when you have that moment of, my gut tells me that something's not right with my baby. Let's see, what else do I want to talk about really quickly here is sleep. Now, babies sleep a lot. One of the things that I always try and help parents with is getting their days and nights straight. Now, babies will come out and they're not used to sunlight, so they're not used to sleeping during the night and being awake during the day. And so that's something that we have to help them with. And you can do that. And usually within about 10 days, you can have their sleep cycles set up so that they're sleeping more at night and sleeping less during the day. The biggest things here that you want to focus on is during the day. This is, you go home from the hospital, you're trying to get on a regular routine. During the day, bright room, background noise, so that they get used to frequent feeding and waking them up more frequently when they are, sleeping. You say, okay, it's been 2 hours, I want to try and get more feeds in them during the day. It's okay to wake a sleeping baby during daylight hours. And then conversely, at night, we can do quiet room, maybe like a noise machine or some sort of white noise to try and dampen the sound of the room. But then otherwise, dark room, feed, back to sleep, feed, back to sleep, feed, back to sleep. Those two things will dramatically help. And then once we're back at birth weight, you don't have to set an alarm. Before baby has reached their birth weight, so you go home from the hospital, during the day, you're gonna wanna feed them every 2 to 3 hours. And then at night, I think every 3 to 4 hours is perfectly fine. But once they're back at birth weight, you don't have to set an alarm anymore. You can let baby set the alarm so that you are able to get a little bit more rest if baby lets you get rest. And swaddling makes a huge difference with that too. Now, I know that we're about out of time for the time that I've been allotted. I'll tell you really quickly about our practice, Frontier Pediatric Care. Our website here is where most people go if they want to book a meet and greet to talk with us and see if we're a good fit for you, or to join our practice. Some of the cool things that we do is we do in-home newborn visits for families that live in Lincoln. You go home from the hospital, instead of having to pack baby up and lug them to the office the next day, we just come out to your house and we see baby at your house. We bring all the stuff so that we can see you. Like I said, we have 2 lactation counselors. Lindsay is a physician assistant who's a lactation counselor. Clara on our team is a nurse practitioner. She's a lactation counselor. So they can both help with lactation. The biggest feature that everyone loves is text messaging. So we do text messaging so that parents can ask all those random questions that they come up with without having to feel like, okay, I have to call. They're going to say I have to come in. I have to make an appointment. 70 to 80% of our visits can be handled over text message. And so we save a lot of trips to the office when it's simple questions, things that you would otherwise have to Google or guess at. Parents just ask us. They also send us a lot of text messages with pictures of their baby's rashes. And this one's going to surprise you. You're going to take a lot of pictures of your baby's poop in the coming weeks and months, because you're like, is this poop normal or is this poop weird? Is something off? And so we get a lot of newborn rash pictures. We get a lot of poop pictures too. And so if you're interested, our practice, I love getting to take care of families. We have a small practice. There's just the 3 of us in terms of the clinicians. So there's myself, there's Lindsay, and there's Clara, and we're intentionally small so that we all know the families really well. We know you and what your preferences are and what you like, and it makes it super easy and fun for us to get to care for families and really know them in depth. And so if that's something of interest to you, our website is Frontier Pediatric. That's right here. I won't write the whole thing out. I also do a lot of content on Instagram, so at Phil Boucher, MD on Instagram, and then on Substack too. Yeah, you might not use Substack, but I like to write on there and talk about a lot of parenting things too. But my main place that people find me is on Instagram. Hopefully this has been helpful. If you got more questions, like I said, you can just text us. It's 402-788-4888, or just go to our website, talk through all these other things that we didn't have a chance to cover today. Congrats, good luck, keep up the good work, and thanks.